Hello everyone, I welcome you all to this XL 4.0 Periodontics course. Like every year, I'm excited, I'm elated that I will be a part of your journey to a government MDS seat. Good evening, Doc. Good evening. Yes, good evening, everyone. Okay, and I promise to you that this is going to be the best ever periodontics lecture that you have attended. And I do not know how good already you are in periodontics, but I will leave no stone unturned in making Perio even better for you. Like, this happens every year that everyone says, yes, sir, we were able to crack all the questions which were there in Perio exam. In the exam about Perio, and you will develop that belief, and that is very very important for me to instill that belief in you that yes, in Perio, whatever comes from wherever source, we will be able to solve it. All right. I hope you all know me. I am Dr. Sagar Garg. I did my UG. A brief introduction about myself because in detail we will be talking about Carenza, about Perio. But yes, you still need to know me. I am from 2005 batch. I did my UG from Aligarh Muslim University, Dr. Ziauddin Ahmed Dental College. And then I went from UP to Tamil Nadu, to Chennai, Government Dental College, Chennai, to did my PG in Periodontics and Oral Implantology. And I am happy because today when I look back, when I try to analyze, summarize some of my journey, I was very fortunate to have done both my UG and PG from a government college. Okay. So, guys, you have to make sure that you end up in a government college for a PG. Okay. Because that gives you the best possible chances of enhancing your skills as a dentist in whichever branch you go. Your knowledge will increase manifold when you do it from a government college. So, I'm there. And ultimately, guys, the outlook towards life should be as such that you will gain something out of whatever you are doing. Okay. बोलते हैं ना कि पढ़ाई कभी बेकार नहीं जाती. It's like that. These lectures, not just for your PG, I can assure you, because every year, like people who are running their clinics after doing their PG, in even like someone who is an oral surgeon and he comes across as a case in periodontics, when they talk to me, they message me, sir, I am from 2020 batch and you once told us this thing in flap surgery. Today a patient came and I just recalled it. So I cannot tell you that feeling that I have, because I do not remember that guy who I taught in 2020 or 2022. But still, when they message you, when they just acknowledge you, it feels great that yes, I am doing something good. I'm making a positive change in someone else's life. All right, and that's why I went into this teaching thing, right? That's why I joined in BDS to MDS. Okay, guys. So anything, and right before starting with the lecture, I just want to make sure one thing, that we all are on the same page. As in, whenever you have a doubt, you will just interrupt me. You will ask me, sir, ye samajh nahi aaya, or can you repeat it? Okay. Or we might want to have 2 or 3 minutes more on this. Can you go a bit more in detail over this? Because wherever I need to go in more detail, I will definitely go. But it's also about doing smart studies. Wherever I guess like you guys are wasting your time in that particular topic, in which there are very less chances of a question being asked, I will say you please stop it there. You do not need to go into detail in that point. That is why, guys, each one of you, please do not hesitate during these lectures. Even after the lecture, you can message me, you can WhatsApp me personally, sir, I couldn't catch this thing and I couldn't ask at that point of time because I was thinking that course must be going on. Okay. And you please tell me which book you refer to in Carenza, which is your go-to book for Carenza whenever you have doubts. Do you all study Carenza or any other book you refer to? Please, guys, tell me. Am I audible or not? Carenza only. Great. And ready. I read ready somewhere. Guys, please study Carenza only. That was the point of asking this question, because out of 100, even if one of you is referring to some other book, I will humbly request you to drop that book and study from Carenza only. Okay, because if you do this mistake of reading from any other book during UG, it was fine for clearing your exam, any other book was fine, but now you have to study from Carenza only, guys. Please, no other book. Okay, I'll make this humble request from you. And most of you would have had workbooks also with you, right? Workbooks have been sent to you. So it's up to you whether you open it or not along while I'm teaching you, because a lot of text is there available. So you do not need to write. Many of you who are having their workbooks along with you, it's totally up to you whether you open it or not. But I guess I can just assure you that nothing will be left from Carenza. Yeah, I mean, it will be there in the process of being delivered. Many of you would have received, few will be receiving very soon. But no issues, guys. I'm there. Okay. I'll make sure that nothing remains unread. Okay. So on that note, I will start with the chapter, the most important one in periodontics, which is the anatomy of the periodontium. And once again, I'm saying, whenever you have a doubt, you just stop me. Okay, you interrupt me, sir. Please explain this again. Okay, anatomy of the periodontium. In this chapter, we will be studying. I mean, we segregate this into 4 parts, starting with the first one, which is gingiva. And guys, one more thing which you need to be very blunt about is my handwriting. Because when I go into that zone, okay, my handwriting goes from bad to worse. My handwriting is bad. Okay, I know this. So, sir, we will have to study Carenza plus notes. You have to study notes. Carenza is for your reference. Whenever you have doubts, you go to Carenza. For images, you go to Carenza. Okay. While like the chapters that you study today, whatever I teach you today, you just like a newspaper you read, like a novel you read, you just go through Carenza of those pages. Okay. So that once you are through it, and Carenza is a very simple book, guys. You do not have to dig into it deep. Okay, so I'll make sure that Carenza becomes even more simpler for you through my notes, through my lecture. But still, whenever I mean, during the course of the lectures, you will get to know it yourself, guys. Okay, it's organic that people get to know how to study with Carenza. And you will ask me time to time, sir, I have studied this chapter from Carenza. With your notes, this thing was not getting clear, so I went to Carenza. Okay, if you might say like that. Okay, guys, so do not get tensed about it. Notes are there. Okay, I try to cover everything in notes, but still, guys, I'm not Carenza. Okay, I cannot be above Carenza. From Carenza, I read. Okay, that movie, no, Ritik's movie, Computer, Human, something like that, he said. So, similarly, I said, Carenza did not study from me, I studied from Carenza. So, I'll always put Carenza above me. Right? Sir, I started 13th edition. It was not enough flow because you would have studied yourself first. Now it will be flowing gently, beautifully for you once you study it after I teach you. All right, guys? Chalo. Gingiva it is. Gingiva is that part of the periodontium which covers bone and the root of the tooth coronal to CEJ. All right. Gingiva is that part of the periodontium which covers the bone, the complete bone, and the root of the tooth coronal to the CEJ. And it is divided anatomically into 3 parts. Right? We divide it anatomically into 3 parts. marginal, attached, and interdental. All right. So these are the three parts of gingiva. Where is that option in this where we can insert something? Okay, guys, can you just look at this image? Please tell me in positive whether you can see this image clearly or not. Can you see this image or not? All right. So see, this is your gingiva. Okay. Now this is your tooth. This thing, the gray structure is your tooth. All right. And this yellow structure is the bone. Okay. And this is your gingiva. Now in this gingiva, this part, is your marginal gingiva, right? This one, this is the marginal gingiva. Where the marginal gingiva ends till this point, which is your mucogingival junction, is your attached gingiva. All right. And below the mucogingival junction lies your alveolar mucosa. All right. So one by one, I will be telling you about marginal gingiva, attached gingiva, and interdental papilla, the anatomic divisions of gingiva. All right, guys. Okay. So marginal gingiva is free. It is not attached to the bone, right? That's why it is also called as unattached gingiva. It is free and unattached. It forms the soft tissue wall of the gingival sulcus, right? It forms the soft tissue walls of the gingival sulcus, and it is demarcated or separated from the attached gingiva by free gingival groove. All right. This free gingival groove is also called as marginal groove, the other name, so that you do not get confused if it is asked. All right. This marginal groove, remember one thing, because our subject is a lot about values. This marginal groove is present in 50% of the cases, or 50% of the individuals, right? So in 50% of the individuals, the marginal gingiva is separated from attached gingiva by a clear-cut division, which is called as free gingival groove or marginal groove, right? Now the width of marginal gingiva is 1 mm, right? This is very, very important, this 1 mm. And there is something called as gingival zenith. Okay, gingival zenith. I will ask you to ask me if you do not understand what this zenith is, right? This is the most apical point on the marginal gingiva. Okay, the book says the exact words I'm saying. Most apical point on the marginal gingival scallop is the gingival zenith, right? Like you say, like this is a tooth. Okay, so this is the most apical point. This is the gingival zenith. Why this gingival zenith is important? Like whenever you give crowns, your FPD in prosthodontics, okay, and you have to do that crown preparation. What do we see? That the central incisors should be at the same level. Okay, so if while doing crown preparation, it is